Hey, what's up, everyone? It's Dr. Glenn Vo, and I am super excited. I'm super excited to have a doctor I've been looking up to for years. I've taken 2 courses with him at Arrowhead Dental Lab. Dr. Downs. Dr. Downs, how you doing today?
We're doing great. Great, Glenn. How you doing?
Oh, I'm doing great. And the lovely lady right next to him is Peggy Nelson. She is, basically, you're the head of the education at Arrowhead Labs, right, Peggy?
Yes,
Oh.
I am.
Well,
I'm doing what she tells me to do, Glenn.
And I'm so super excited to have you guys on. But really, I was telling Peggy, gosh, you know, the courses at Arrowhead Dental Lab, it is dentistry's best kept secret. I mean, when I took some classes with Dr. Downs, taking 2 of them, 2 big ones, and I was like, I cannot believe that I was taking this course and I paid this much and I got all this attention. He answered all the questions. And I was looking at my wife. I was like, I can't believe more people aren't taking this. And so finally, I got connected with Robbie, and I talked to him. I was like, look, I need to bring Dr. Downs on here. Because literally the course is the niftiest, thriftiest course out there. But Dr. Downs, I wanted to bring you on because I want everyone to know who you are. And let's start off with this. Dr. Downs, tell us about your dental background, how long you've been practicing, and how did you get all caught up in this, this business of educating all these dentists?
Well, one of the things that, got me into dentistry, just a quick thing is we were looking at, the camera here and how I was going to Peggy, this is not my, this is my good side. That's not my good side. and why that is that I sustained a facial trauma, and that was playing goalie in a soccer game. And you probably heard that story as well. And one thing led to another where, I had wired shut for 4 months. The surgeon told me don't throw up. Ate through a straw. And so when I got everything off, my jaw wouldn't work. And no one knew what to do. One person to the next. Then I just found that just in competitive nature of myself, I made it a point and passion in my life to fix me. So in doing so, as you do that, you meet people from all over and you get mentors and you have the opportunities to get the little pearls in here and there and there. And I just found that was my mission. And so I went to Tufts University because that was the first dental clinic to have a TMJ clinic, official one. Dr. Mehta was the clinical instructor there. So I became a patient and a student. And that led one thing to another. As an educator, that it was something I never went looking for. Mm-hmm. It came looking for me. And that was with Dr. Barnes. I met him back in 1998, and I sent a case in, and he really loved the preps that I did. And he called me in and he said, I want you to teach our doctors how to do this. And it's led one thing to another. And then, it just does this over time, right? So here I am, and as you've been to the courses, I just love doing that. And as you know, I got 2 practices, so I'm chairside more than I am lecturing.
And that's what really impressed me the most when I took the course. Dr. Downs, I just dove right in. The very first course that I took at Arrowhead was the full arch reconstruction. Well, I just dove in. My wife and we just dove in, and then we took the occlusion course, and we're definitely going to come back and take some more courses there. But the one thing that I was so impressed by you is that you're a practicing dentist. Some of these instructors, they teach CE. That's all they do all day long.
Yeah.
But you see the same challenges down to times when you talk to us about how to increase production in our practice. That's a whole course in itself, but you still spent some time there. And we talked about, I remember we talked about, PPO reimbursement. It's going down. It stayed the same for years. It's going down. There's corporate dentistry. There's all these challenges. And how do we stay profitable, right? And you talk about, there's your patients, they need this dentistry. And how do you do it? Right. And so let's touch on that full arch reconstruction, because that was like my first taste of Arrowhead, and going into it, I'm like, oh my gosh, I don't know how to do this. This is huge. I feel like I need to refer to this. And you told us you don't want to refer that. That's those patients want to be seen by you, and talk about that, about
Yeah.
How can you kind of stem the tide of low PPO and reimbursement and corporate dentistry?
Great question, Glenn. That's probably something we hear quite a bit. And we call that being comprehensive trained, right? So what's that mean? It's about like there's nothing else in your body, in your entire body, that functions in isolation. Yeah, how come we're taught to be tooth mechanics and not look at the whole picture? And so comprehensive is taking a look at that forest through the trees. And actually this weekend, we have that course here. I think we got 22 or some doctors here from all over. And because when you come out of dental school, you're a mechanic. That's basically it. Now, how do you get to that point of how you can go about figuring out what to do? And that's what you're talking about. You're like, wow, how did you make that all happen? I mean, it goes, Glenn, from the basics of learning how to prep design, how to decide on materials, and who's the doctor, and so just even the other day in my own practice, right? A patient came in and was saying, they went down, saw another practice, and I don't make any of the corporates or anything bad. I invite them, because what we find is that if we can take the time with the patient, explain to them, educate them in a way that builds value, they see the difference. And now it's about, as you saw, how we like everyone could learn how to wield that sword, right? And prep great and all that. But if they can't get the yes from the patient, not going to happen. You might as well go teach at dental school. Don't recommend that. I'm not recommending that.
And that's what that's what I really loved about that course, because the course was full arch reconstruction, right? And then I took another course, which everyday occlusion. But in between all the clinical and all that didactic, you talked a lot about practice management. You talked about, getting case acceptance. You talked about really listening to the patient. And one thing that you said to me that really stuck to me was that these patients want to be treated. Yes. They not every patient wants the one tooth at a time until one day it actually obliterates and then they have to extract the tooth. They want this type of treatment.
They do. And even, my wife, who's a dentist, Dr. Nikki Lay, she was telling me the other day, and she's got this stuff down. She's got it down. She had a 70-year-old. Where was the mentoring? A simple question like that, Glenn, you see someone who comes in there, all the broken down, and you're like, just out of curiosity, where was the mentoring with you and helping you keep your teeth alive? Simple verbiage like this that opens up a Pandora's box of, oh yeah, this happened. And now the job of the dentist is to then figure out how we can do it in a way in which it fits in their budget, right? And sequence it. But never, ever give up on giving them the finest dentistry on that.
And I think that's so important, because now this day and age, it just seems that, we fall into that trap. Okay, the patient only wants to deal with insurance, offers, right? Let's tailor make our treatment plans, because we want them to say yes. We don't want them to say no. So, oh my gosh, I don't know if I want to tell them they need all these crowns. Maybe I'll say a few things. I heard a doctor at one of the courses say that. And, when he said it, I was like, oh, okay, I can see where you're coming from. But then you kind of brought it back out and said, guys, you know better, right? You know better. And what's going to happen to that patient? And it just kind of light bulb went on my head. I was like, oh, yeah, we do know better, right? We know that tooth is fractured. Something bad is going to happen. That amalgam, there's no real need to keep watching that. Someone else has been watching it for like 15 years, and now you're going to watch it for another few years. But that is, I guess that's like a big hurdle. And you just dive into that.
Huge, and you know what that is, Glenn? That's that whole approval addiction. The approval addiction of, when patients come in, Peggy, they go, I'd rather have a child than to be in the chair. And you're like, well, no problem, we can fix the chair. But anyway, it's that approval addiction, and how to learn how to deal with those personalities And that's one thing I know that we've been working on. We've been hearing from our doctors, been through the programs like yourself, saying, hey, we need something solid on that, on how to deal with that, how to do the, martial arts routine here on deflection of objections, and having that confidence to talk to the patient in a which way they get it and understand it. The money thing for me, yeah, it's real. Yet what we find is if we get that patient to totally understand that, like you were hearing these doctors going, yeah, I do this, but wait a minute, that's your gremlin talking. That's your gremlin. That's your approval diction gremlin. Let's do what you want to do on your mom, your dad, your sisters, right? And the best.
Yeah, no, I totally agree. And we have a lot of people jumping on right now. Guys, if you like what you're hearing right now, type in the comments section, Arrowhead. And if you have questions, Dr. Downs here to ask some questions. If you don't know who he is, you're about to learn right now. Dr. Downs is like one of the best educators out there. And Dr. Downs, I want to ask you this here. So the courses are set up in a certain way. There's full arch and reconstruction, there's occlusion, there's implants, there is also total team training, know your numbers, all those things, airway management. Now we have the cone beam surgery. I don't think that was there when I was started, but let me ask you this: why is the curriculum focused on those things as opposed to other facets of dentistry?
Yeah, great question. That's your bread and butter.
Yeah.
That's what the 80-20 rule, right? That's 80% of the time. That's what you're going to be doing. Mm-hmm. And people want you to do it. And so, if we can give you something that's predictable, adaptable, and sustainable in your hands for 30, 40 years, you're going to have a great dental life and feel fulfilled in that by saying that I am a true dentist, physician of the oral cavity, not a mechanic. Right? So you've seen me, and I get passionate about it. When I put the key in the door, I'm not saying, please break, please Blake, I open that door and it's showtime. And patients want that from you.
And there's one of the assistant instructors, Dr. Britton. So he was there each time, and we're actually from the same metroplex. He's down in Arlington, I'm up in Denton, so I'm on the north side, he's on the south side. But he was somebody who went through the program, and he gave us his story. He was practicing dentistry. He was getting beat down. He was getting burned out. And so many times I hear that just on social media, all these dentists are like, oh gosh, how many more years we have? There's one dentist, it's a running gag that he says, I have X amount of years. He's been doing a countdown for as long as I've been a dentist. And this year it's going to be like, okay, he has 4 more years or something. He's almost there, right? We have dentists who are looking to do other things. They want to do all these different things. And Dr. Britton was saying, it was because I was just getting beat down. But going to Arrowhead, it totally changed his life, totally changed his mentality. Now he's one of the instructors. I want to ask you, Dr. Downs, and then I want to ask you, Peggy. But I'm going to ask you, Dr. Downs, how many of those type of stories do you hear of these dentists? And there was I forgot his name, but he practices in California. He was an older gentleman, and he was there. I think it was his 4th time taking the course. Yeah. And I looked at him. I was like, "Oh, I know who you're talking about." I was like, first of all, why are you still practicing? He said, "Because I love it now. I love it." And I was like, "You're here for the 4th time." He says, "Each time I come back, I learn something new." You'll probably come back 4 times yourself. But anyways, those are just 2 people that I talked to when I was there. But I'm sure you hear a lot of it. Tell me about the lives.
We don't have the time.
Name out a few things.
I'm telling you, there's 1 or 2 at every course. You know how we go around and you all talk about yourself, and eventually at the break or at our little community dinner in the evening, one will come up and say, "You hit me right between the eyes." I never know what I'm going to say, Glenn. You know that. It just comes out of my mouth. But the point of that is that, we are in a great profession. You just need to know how to deal with the gremlins about it and how to do it in a way that you are, if you keep getting no, yeah, you get beat down. But we teach, we teach you how to talk to the patients. Now, and Dr. Britton's story is a special story, but I can assure you we've had even more, pulled people off of bankruptcy. You don't know how many we've saved. And we don't mind running under the radar about that, because as you saw, it's an intimate group.
It is. You
get me, right? You get the real deal. And I'm not in the seminar business. I got 2 practices, but I'm telling you why I like this. And when you said about this earlier, about there's some lecturers or educators, that's all they do because they don't want to be in the little hole anymore. Right. No, I do it. So I'm congruent back in my office.
And Peggy, I'll ask you the same question, because, you deal with doctors so many times. You have them come in and talk to you about, they took one course and should I take some other courses? Or you'll have people call you and ask about the courses. And you've probably seen some of these people who come over and over again. You see the lives have changed. Talk about that. And how does that make you feel, being a part of their journey here?
Yeah, I definitely feel humbled, because I really feel that the Barnes family is a family. And when you come to a course here, you're joining a great family. And we do feel that all of our doctors that do come become a part of us, like-minded with what they want to focus on. Mm-hmm. I get the privilege to meet so many doctors here that they want more for their career. And they want more for their patients, and they feel stuck, if you will. I get emails. A lot of times we share the emails that go back and forth with those that attend these courses. And sometimes I'll get them before, where, they were sharing an experience with a colleague and they had mentioned, you need to go hear Dr. Downs. And it's like their last cry. I mean, Dr. Britton's not solo with this. And so it just gives a lot of doctors hope. I hear from them, that Monday morning, and their world has changed. The way they diagnose, the way they see their patients, the way they treat them. They said, I've learned more about being a good person at these courses and how to treat these patients than I've ever thought or imagined I'd get from a course. The other thing is we really simplify the process. Every course that we teach in 2 days, Dr. Downs is busy. So we're like, give us everything in 2 days and simplify it in a structure and a checkoff list so that doctors can be successful. It's not intended for a course, to keep repeating, but that's ultimately you're at different stages in your career. The doctor you're talking about, I actually worked for right out of high school in California. So we ran into each other about 15 years ago at the course, and our lives kind of gelled back together. But he just signed up again for February. Wow. And
that's number 5 for him.
He's
or 6 now. I don't know, because it's been a few years for me, so it might be 6 now. But what was amazing about him is that here's somebody who's been practicing for a while. And I make it a habit that whenever I go to a CE course, I make a beeline for the oldest person in the class. I make a beeline to them, and I basically ask them, what are you doing here? Okay. Most of the time it's they made a few personal mistakes and now they're paying for it and they got to still work. But that doctor is like, I love this stuff. I have been taking this. He told me, this is my 4th time. I was like, your 4th time? I was like, is it that hard to pick up? Do I have to go multiple times? He was like, no, I actually enjoy coming back. He says, I like to come back. I like to recalibrate because things are different.
Yeah.
And he told me how much he loves practicing dentistry. He loves practicing dentistry now and the twilight of his career. Maybe it's probably not. I think this guy's going to keep working until he just can't anymore. He said he enjoyed it more than when he was a lot younger.
Yes.
And that was something that made me feel pretty good.
Yeah.
But literally, this is someone who went 4 times, and I guess that's his 5th or something in February and whatnot. Dr. Downs, let me ask you this, because this is the biggest thing. And I was skeptical. I'll admit, before I went out to Arrowhead, I was very skeptical. Full arch reconstruction? How many? 2 days? What are these guys talking about here? Okay, well, I will say this, guys. Right when you go down and you sit down, you better get ready to work. Dr. Downs, he just goes the whole time. I mean, and he'll make sure you're listening, because he'll call. I was so surprised, Dr. Downs, you knew everyone's name. You were like, Glenn, wait a minute. How does he know my name already? Man, you know, what's going on there? But Dr. Downs, how do you do it? Because there's so many courses where you have to take, there's occlusion 1, 2, 3, 4, 5, 10 classes or something. There's 8 classes for full arch reconstruction. I mean, you guys really condense it and get it done in 2 days. How do you do that?
It's called T-shirts. You know what T-shirts are? I've made the mistakes. So why not pass on to anyone, even including my associate who's been with me 4 years, the T-shirts, so I can advance you much faster. And so we know what the problems are. And when you go to, you know, that's why I say we're not in the seminar business.
Yeah.
Dr. Barnes, who's my mentor, had said, Jim, teach these doctors so they can go back Monday morning and start seeing their world differently. And that's what we do. And so, you know, Glenn, I've been at it 30 years now. And I can tell you it's a heartbeat. And so I've got all these T-shirts. I don't want you to have them. But so what we do is, you know, we find what works. We get you back. You know, we've been to all these courses. We've been to all the different occlusal camps out there. We've been through this and that and what works and what doesn't work. Time's too short, man.
Yeah.
30 years will go by in a heartbeat. And the guy you keep talking about, he's almost 50 years in practice.
It's amazing. And he still has that look like, I still love practicing dentistry, which was really motivating for me. And, you know, with the course, we'll talk about because that's obviously one of my favorite courses at Arrowhead is the full arch reconstruction. But guys, it's not just, you know what? I'm not going to even talk about Dr. Downs. Let's talk about the course. When someone goes into the course, what can they expect? What do they see? Are they sitting there listening to you flip through slides the whole time? What can they expect?
So you saw as well, it's interactive. So the moment they get here, and you know, it's showtime. Anyway, so we start out with the morning, and the morning is a live patient.
Yeah.
So it's a live patient. We go through diagnosis, and we kind of do it quickly because some of the doctors have come to everyday occlusion, and that's a 2-day. Basically, it's diagnosis. And so it sets up the day for now the execution of the case, not the patient, but the go on through the process of sequencing the prepping, holding the bite, if you're verticalizing, everything down to the nitty gritty. You saw even tissue design. Mm-hmm. And you saw, and so within I think it's 3 hours, start to finish, we accomplish that. And I've learned to talk and prep at the same time. It's kind of tough, but you learn.
Well, you get the cool cameras too, so everyone can see.
Doctors can actually be over my shoulder, and that's why we call it over the shoulder, and then watch it closed circuit in the other room as well.
And so, you know, that's really important because so many times you go to a course and all they are doing is flipping through slides, right? Yeah. Look at this. But what amazed me was there was an actual patient there. Yeah, there was an actual patient there. We actually talked to the patient.
Yeah,
we actually talked to them. We were asking them how did it go? And they are answering it there. It's not like somebody that's not we are literally right in front of them. And it's amazing. It's amazing. Now let's talk about the occlusion as well. You know, occlusion. There's whole continuums where you take 5 classes of occlusion. Yeah. I mean, you're just taking so many. You're flying, but you guys condense it in 2 days. So just walk through the occlusion course. What do you expect?
Because the course is called Everyday Occlusion, you see this in your practice.
Oh, yeah.
Everyone's occlusion isn't the same. In fact, if there was one way in which to do occlusal training, it would be done in dental school. But because we're all different, you know, where does CR work? Where does CO work? Where you don't change anything. And then where does a physiologic approach work? So all those are different. And the idea there is for the doctor to recognize which one is it. So if you got someone who's really collapsed and they say, hey, I want to be veneered, and you're like, yeah, that's a good day, you know, and then you do it and everything falls into masterpieces, you know, your masterpiece isn't going to last, and those are not going to be your patients that'll last with you. So that 2 days is condensed into, you know, what to see, how you're going to approach it. And then here, even at the lab, the technical support people at Arrowhead now know how to take the ball with you and continue that process. So it's 2 days, as you know, it's rock and roll. It's rock.
Yeah. And you touched on something that's really important, Peggy. I'm going to bring you in here. What's so unique is that, you know, you do the course, you're learning all these great things, and you know, during lunchtime, you guys come in and say, hey, you want to just kind of check out the lab, take a look at it, and guys, I'm going to say this right now. It's not some little dusty couple of benches and there's lab pans everywhere. And it's like, you know, you got to put like a coat on because you don't want to get dirt. No, everything's organized. But what is so cool is that you can see the communication they have with the doctors, right? And how everything is organized. But if you're taking the course, they know exactly what your sequence is, how you're prepping, what you're doing. They know because what Dr. Downs is there teaching. Thinking, how important is that? How important is that to have a lab that kind of understands where you got your training and how you sequence all your cases? Why is that so important?
Well, it's huge. People leave their labs for poor communication. And so for us, communication is key. So if we're teaching a structure that we want doctors to follow, we've dialed it in with the educator so that you can get predictability in your cases. And so really, our lab, the whole point of education is to be able to build a partnership with our doctors that's a win-win. And so why not educate in areas? And Dr. Downs will ask the technicians, what do you need more of? Yeah. He'll walk around when he comes out and he picks out these cases that he's like, what was this guy on when he prepped today? You know? And so he'll look at that, and that's why we put a Beyond the Basics, where it's a hand-holding prepping course. And Dr. Downs is there walking people through how to keep your burr down, how to make good margins.
The two-handed technique, I use it to this day, Dr. Downs.
Yes.
I love it. And you know, when you first talked about that and you did it and you talked about it, I'm like, yeah, let me see this guy do it himself. You went over the patient, you actually did it. I'm like, oh my gosh, he does it. But it's so amazing. And guys, what we're talking about is that, you know how when we prep a tooth, if you don't have a finger, some people don't use a finger rest, and they're just like you're just balancing it in air, right? And if you think about it, how are your margins going to look? Because look, I mean, if you hold it under your hand out, see how still you can do it. No, it's going to start shaking there. It's the whole two-handed technique there. Look, if you guys want to learn more about that, you got to type in the comment section, Arrowhead. Maybe Dr. Downs will talk about it, but you got to come to the course. But Peggy, that is so true, because dentists, you know what? I'll admit it. Sometimes we'll say, what's wrong with the lab? That lab, oh my gosh. And really, maybe we didn't give them enough information. Maybe we didn't give them the right information, right? Like right information being a decent impression, or maybe some extra information. And when we're talking about Dr. Downs' full mouth rehab, you got to have that communication, right, Dr. Downs?
Oh, absolutely. You got to have that all up front too, before you even step in that chair to start it.
Because there's a lot of money riding on those cases there.
Huge.
Yeah, and you can get yourself in trouble there. And so, Peggy, I said this too. I said this many times when we're on the phone. I was like, gosh, Peggy, I don't understand. Like, you guys can charge so much more. I was like, man, I don't get it. And really, it's about, you want to have these relationships with these doctors. You want to give them the skills so that you don't have that conversation where, oh, no, it's your fault. No, doctor, it's your fault. Your fault. No, we don't want it to be anyone's fault. So would you say that's kind of like the reason why Arrowhead created these courses?
Yeah, definitely. The thinking behind the courses, Dr. Barnes started these over 40 years ago. And really the thinking behind it is to build a partnership as a lab. And again, you've heard Dr. Downs say we're not in the seminar business. But you know what's interesting is I try to keep tabs on how seminars are doing out in general in dentistry. And we've had vendors ask, how do you keep yours full? Because we are having such a problem with selling out our courses, and we sell out. People think it's a tactic that I tell them, you got to hurry and decide, because we sell out 3 to 4 months in advance on these courses. And it's, you know, it's things like this where you share with your colleagues, you tell them of the experiences you have, but it's also, it is an affordable way to get great education, because ultimately we want to be your lab. You know, we want to help you with these types of cases because we know where to dial it in so that on game day, you're not sweating. You know, you go in with confidence and you deliver a great product.
Well, when you're doing a, you know, $10, $20, $30,000 case, you better have it dialed in, and it better go smooth, or else you're gonna get bit financially and also emotionally and possibly physically sometimes. But you know what you were saying, Peggy, about the courses selling out. I actually was looking today. One of the courses that I wanted to take was the hands-on, and I was like, oh, I'm gonna go in March. What? It's sold out. It's November. It's sold out. I'm gonna have to wait until next year, like next October, to go. You know, and so the thing is that you guys keep your classes really small, right?
Yeah. We do.
Yeah, and Peggy, why is that? Why? I mean, you guys could fill like a huge hotel room if you wanted to, a banquet room if you wanted to. But why do you like to keep it small like that?
Yeah, we've really dialed in the intimacy. We want this to be a learning environment, and we feel that the size of the class really does matter, so that everyone's comfortable. It's a very comfortable setting to ask questions. And, you know, to admit you don't know is okay when you're in a room that size. We feel if you go larger, then we lose people and we lose the connection. Dr. Downs really connects with everyone and learns, you know, what is it that you're here to learn and gain. And he makes sure that he delivers that by Saturday afternoon by going around and saying, tell me your aha moment, you know, what's going to change for you Monday morning. And when you get large and you're in it for the wrong reasons, in our opinion, and it just is an education course, it's the heart is missing almost, you know. It's really intimate. It's very, I don't know. Is that what you, so.
Well, there's no, I will say this, in these classes with Dr. Downs, there's no sliding down in your chair and hiding. Everyone, he's going to call on you. Everyone participates. Everyone talks about it. People bring cases. People talk about their experiences, their challenges, their wins, and all those things. That's what I love about it. And, you know, speaking of Dr. Downs, we have a comment from the audience in this. Dr. Downs, man, the myth, the ninja. So, all right. So Dr. Downs, you know, the class that I was actually looking at, that I've been wanting to take, I have a family member. I wanted to bring her out. I was going to just do like a full mouth rehab on this family member as a gift to her, but also just to like refine my skills. That class was the hands-on in your office. I guess I'm gonna have to wait till October, but talk about that, because people always say, all right, well, okay, these courses sound good. I get to watch the one, but I want to do it.
Yeah.
Well, here's your chance. So talk about that.
I got the goosebumps right there.
so talk about that.
Ninja, right?
Yeah. No, I mean, it's about the hands-on. Yeah. The hands-on is where the rubber hits the road. Mm-hmm. And, you know, we keep that class very small, under 6. And I'm just, the cases next week will be finishing. They'll be coming back to bond everything. And just the doctors talking about their experience already from that weekend. Yeah. I mean, I'm excited because it's changed their lives. Everyone we know, Glenn, that's gone through that has taken off.
Oh yeah.
They've taken off. I mean, we got too many stories we wouldn't even be able to talk about.
But the way it's set up is that you come on one weekend and you prep the case.
Yeah.
You prepare.
It's intense.
You prep the case. Now, is it one arch, both arches?
Typically one arch.
Okay.
Now, if you come back a second time, all right, one arch and lower 8. So sometimes it depends. We've had doctors take it 3 times. You come back each time, we're going to push you harder.
Yeah.
You know, so that it gets to a point where anything that walks in your practice, you can handle it. You got a choice, right? You got a choice. But the hands-on and oh my gosh, I can't wait for next weekend because that is where the culmination of everything comes together. They bond the cases in, and when it's done, the doctors are crying, the patients are crying, the assistants are crying. They got to bring their assistants, you know, for this. And then we have a huge celebration at my house. And where my mother-in-law, who's Vietnamese, makes a great caters a great dinner for everyone, and everyone has that opportunity to celebrate in what they've learned, and it's life-changing for the dentist. It really is. It really is.
Well, you know, what a great way to put all those things you learn together, right? Number one, but also what a great feeling changing the life of that patient you bring, whether it's a family member. I know a lot of people, a couple of guys told me that they brought a family member or a friend or maybe one of their team members, but the being able to celebrate that change too, right there.
Oh, huge. That's what makes you continue to go on. That part right there.
There you go. There you go. I love it, guys. And if you like what you're hearing right now, type in the comments section, Arrowhead. And so Dr. Downs, so let's say we have a lot of new dentists that are in our group, right? We have different range. We have some that have been practicing for a while. We even have that dentist who's been doing the countdown and trying to retire and whatnot. We got up to there. But for someone who's young, right, who just got out of school and they just barely just got out of school, got their diploma, and they want to jump into this. Is this the right time for them to jump into this?
Absolutely. Now, let's preface that, because what they're going to learn, and we've had many, even some in their last year of dental school come, you know, their parents or their dad or mom, you know, sent them. But here's the thing that I know for sure, that they don't know how to prep. They don't know how to prep. They were taught in school, which meant they learned by themselves. Think about it. Yeah, it's true, isn't it? It's true. And so just what you were talking about, how to hold two-hand technique, don't lift it for 10 seconds. Right?
Because, you know, when you get out of school, you want to just prep it a little bit and just look, prep it a little bit and just look, right? And before you know it, it took you like an hour and a half to try to do a crown prep.
Well, think about the assistant on the other side going, just prep it. You know? Come on, you know, and we're so in tune to trying to save enamel and whatnot and tickle. But that to me is the most important thing right now. So even in this course this weekend with the full arch, you learn that. Doctors will learn that. I strive on that. The Beyond the Basics one that we just launched, we do a whole day on them prepping various things like crowded situations or how to do a verticalizing case, and how do you then go ahead and take the bite registration for that?
Now, let me ask you this: is that new? Because I don't think that was around when I started.
Yeah, no, it's new because we keep hearing from the young doctors going, "Wow, I really don't feel like I know how to prep properly." I'm not kidding you. It's I get goosebumps thinking about it because we even had some doctors, you know, get to a point where they're trying to prep on it and they can't because they're so scared. I'm not kidding you. That scary.
Now, Peggy, you don't have to mention any names, but has a client of the lab taken that course and has their work changed when they got to the lab?
Drastic.
Have you seen those? Have you seen that?
Yes, it's drastic. There's such a change. In fact, the comment cards put us in the lab longer because we wait for the technicians to leave, and then we set up every hand piece and we put them to work. And all day Saturday, with the exception of teaching them verbiage, because every course we go over case presenting and how to close and how to handle objections, because, you know, let's face it, if you can't sell a case, you'll never do the clinical side.
Yeah.
So that's very important to us. But with that exception, they're in there 6 hours doing their own work and being guided, which fine tunes everything. It's amazing. A lot of them said they learned how to prep on YouTube. Like they didn't learn in school, they learned on YouTube.
Oh yeah.
So yeah.
You know what I'm excited about is when I walk around the lab and I see a case, I go, "Oh, is that mine?" The preps are nice. Oh no, hey, it's Glenn. You know.
Yeah, I love that. And so, okay, so what about a doctor who's maybe they're not fresh out of school? All right, and this is for you, Dr. Downs. And they're not fresh out of school, but let's say they've been out for about 5 years and they prep some teeth. What would you say to them about taking this beyond the basics?
Well, and I would even push it 10 years, 12 years. And these doctors, they think they know what they're doing, and that's fine. We go, great, then let's see what prep this for me. And then we go through, well, let's look at a different strategy. And that strategy is, you know, let's talk about the actual inclination. That means, you know, which way are you going to prep this tooth? And when you get into the front 8 teeth, that is so important, as you probably saw in the FAR course.
Oh yeah.
That's a huge game changer for a lot of doctors. How do you bend a tooth this way? Because you're going to go, well, you know what, this needs endo. No, it doesn't need endo. You need to learn how to prep it properly. Don't make it into a little teepee, but save a lot. And how to bend this tooth so that you get it the right way and not tag the rose garden. You know
and I think that's so important, because a lot of times, you know, if you think about it, if you have to go back to basics, right? Sometimes you have to go back to basics. And I'm actually really excited. Yeah, I actually want to sign up for myself there. But I just wanted to hear from you, because, you know, you don't have to be a new grad to pick these things up. I mean, literally, we have that doctor, you said he's been practicing for, 50 years.
Yeah.
Did you say 50 years? Man, 50 years, and he's going back for the 5th time. The 5th time. I mean, it's like, I mean, my gosh, you know.
You rubbed shoulders with him.
Yeah.
I did. Nicest guy, and literally, I mean, that's why I knew I was in the right place when he said, "Yeah, this is my 4th time, and I still love practicing." And I looked at him like, "Man, are you gonna retire, man?" He's like, "Well, what am I gonna do? I love what I do. You know, it's not work anymore." That's a difference there.
That's right.
It's not work anymore. He's changing lives and whatnot. So, gosh, I love the fact that you guys are both on here. And so, Peggy, you know, I'm going to put you on the spot here. So you're in the Nifty Thrifty Dentist Group. And my goal here is to really connect you guys with the doctors. And the thing is, I've told so many people, that this course is the niftiest, thriftiest course out there. You get so much for it, and the investment is so low. And so, look, I told my members we're going to try to bring something. So, Peggy, what can you guys do here to help out the group here?
Yeah, so what we'd like to offer, some of the things that you were referring to, and Dr. Downs, there is a 10-year and under new dentist program. It's been in the works for, we've done it for maybe 12 years now. Yeah. And we have a lot of graduates from it that go through our core courses that we feel will launch you 10 to 15 years out. Yes. So we do offer a program that's called the New Dentist Program. We also have the full arch, or the back to the basics. We've got some solo courses you can take. On the solo courses, if you want to come experience Dr. Downs or some of our educators, we will offer for the Nifty Thrifty, because our costs are already very minimal. Yeah. There is a cost savings of $350 if you're a member of the Nifty Thrifty. You announce that you're part of the Nifty Thrifty. We will take that off of our tuition total. And we may have a little exclusions with like our hands-on or the summer summit. which we didn't even talk about for the summer summit that's brand new that we've launched. So call me. You can message me on Facebook.
I'm gonna tag Peggy here. So so message her, and then of course call. You'll have a number as well for them to call.
Yes. So Arrowhead, you can call me direct, 800-995-7243, or just call us directly. If you just look up Arrowhead, you'll find everyone that you can talk to. Rob is over Texas. So some of you have rubbed shoulders, especially if they're in your hometown. But we're here to help you. We really just, we love good stories. We love helping dentists to fill their cup and enjoy what they do. That doctor we keep referring to, it really is about changing lives, and we are in the life-changing business. That's what we want to do for you. So.
I absolutely love that. And guys, for those who are watching right now, I actually took 2 courses there, and I actually need to come back. And it is legit. And I met Robbie, and just one of the nicest guys. We've been keeping in touch, and I just told him, I was like, I have to let my members know about this, because I actually feel like I'm keeping something. I feel like I'm keeping something. I don't even think I need to do a deal or anything. I can just bring Dr. Downs on. He's like, let me talk to Peggy. Let's figure something out. Like, we want to kind of support what you're doing, your culture and whatnot. And I got talking to Peggy here, and here we are. And first of all, I'm going to tell you guys right now, when you go look at, we'll put the link in there. When you go see the prices of the course, you're going to think that the discount has already been added. You're going to think it is, but it's not, guys. It's really, that's the price there. And for all you young doctors out there, if you've been practicing less than 10 years, it is a no-brainer. The new dentist curriculum. Peggy, can you just explain to everybody what's included in that, the new dentist curriculum?
Yeah, so you mentioned a little bit about the main core courses, but we give you 2 years. Anyone 10 years and under can take it. According to the ADA, is classified as a new dentist. And it includes our everyday occlusion for that foundational course, the full arch reconstruction, our sleep dentistry course, total team training, which is a structured training to get everyone on the same page. And then it also includes implant dentistry. Depending on where you're at, we do have 2 levels of that course for placement or surgical components. So it's really comprehensive. That one I can't offer a cost savings to you because it's already a good deal,
guys.
It's already in. Yeah,
it's already a good deal, and
I mean, it brings your cost per course to about $1,000 a course. So you're getting 5. Each course is 14 credit hours, and you're getting 5 of those. So
14 credit hour courses.
That's a great dinner.
Yeah, free dinner on us.
Yeah. It's a great restaurant too.
But no, really, it's Dr. Barnes's way to build up the next generation of dentists. We need good dentistry, and we need people to be affected by good quality practitioners. That's our creed, and we want to make them better.
I love it.
Dentistry.
Mm-hmm.
Yeah.
Now, Peggy, I know we didn't talk about this because I was just so happy to see Dr. Downs. I just want to keep it. I totally forgot to bring it up because Robbie, I'll tell you this. Robbie did tell me about it. He's like, hey, don't forget to bring up the summit. Yes. And I'll still focus on just talking to Dr. Downs about like using the two-handed technique and the courses and stuff. Peggy, real quick, you guys are having a summit. It's going to be your first one. Tell us a little bit about it. How many days is it? How many CE credits you'll get? And what is going to be covered?
Yeah. So again, I mentioned we have a lot of clinical courses, and these doctors go back, and I'm sure you're not one of them that goes to education, goes back Monday, and you tell the team that you're going to change everything because you just got inspired. And then they tell each other, just give him a week and he'll be back to his normal self,
Wait a minute.
I'm sure that's not you, but ultimately, we want you to use these clinical skills. And the only way to do that is to be able to present comprehensively and get success in these treatments. And so a lot of these doctors just really want to deliver these results, but what's holding them back is getting to yes. So we spend a little time on ejection handling and how to present, but these doctors have begged for like a 2-day workshop. So our summit is really a workshop environment. We're allowing only 50 doctors. It does include their financial coordinators, because doctors, you don't sell the case until there's financial arrangements. Yeah. And so the financial coordinator is stuck trying to fit this into the patient's budget. And we feel it's a team approach. You both have to be in that presentation with the patient. And so we are combining efforts by saying doctor and your financial coordinator are invited to the summit. It's in beautiful Park City in July. And it's a 2-day program for 14 credit hours. We include your hotel rooms for 2 nights, 2 different hotel rooms, of course, because doctors have asked, wait, I can't stay in the same room with my financial coordinator. So basically,
unless it's your wife.
Unless it's your wife.
Unless your wife.
So it's July 17th and 18th. It's already filling. It's $26.95. So it's still very cost effective.
Yeah, including the room.
Again, what do we get out of it? Ultimately, we want to be able to rub shoulders with you, build that relationship, and ultimately get the lab side. So if we can help you be successful, then, you know, we get the best of both worlds. So
now let me ask you this: is Dr. Downs going to be there?
Yes, he is going to be speaking. He'll be speaking. Hernan Barras, who teaches our team training, will be speaking. In fact, we are launching him at the summit. He'll have a few under his belt, but we basically are launching him now for the team training. And then we have a special guest speaker, Dr. Gary Nankin, who has been following this structure. He was probably one of our first dentists to follow this structure and continues to follow it. And he'll tell you he's got the gray hair and, you know, that he's followed it his whole career and what it's done for him. And it's fault proof. So he'll be speaking as well. So we're really excited.
Excellent. We'll make sure we put that in the comments section. But before we jump off, so first of all, thank you so much, Dr. Downs. Good to see you again. And thank you so much for jumping on and sharing those pearls and talking about the courses and your journey. And then Peggy, thank you so much for the offer to the group. That's the one thing that I've always loved about Arrowhead is that you guys really want the doctors to succeed. And I don't want you guys to be the best kept secret anymore. I mean, this is really influenced me as a practicing dentist. I can't wait to get back there. But before we leave, Dr. Downs, I'm going to give you the last words here. What would you like to say? What kind of advice you'd like to give everyone that's been watching that's kind of grinding through dentistry? You know, maybe they're thinking about retiring and, go selling off to the sunset, or doctors who are just starting, or doctors who are just frustrated. What's your advice to them as they're kind of navigating this day and age of dentistry?
You know, there's always going to have those ups and downs in the day. You got to learn how to be patient. You need to learn how to communicate. And, you know, it's amazing. I don't know what it's going to be for most of the people or dentists, you know, that's getting to them, you know, some way or another. But I can say this, that once you learn what fulfillment means in your life in terms of dentistry, it becomes easy and it becomes a pleasure. And then you want to do more. And to those out there who may be on that fence and struggling, I invite you to come, because I get emotional because I love it. And I know you will too. We figured that out for you. And we don't give up on you either. So, you know, check us out. That's all I can say. If you really want to be a dentist, we're it.
I love it. And I think that's like the best way to end this live stream. Dr. Downs, thank you so much again for your time. And Peggy, thank you so much also for kind of working organizing this whole thing and getting everything set up. I appreciate it. And guys, if you want to learn more about Arrowhead Dental Lab, we're going to put the comments in the comments section. We'll put the information, put the Nifty deal as well. And Peggy's in our group, guys. So reach out to her, reach out to Robbie as well. And then they also have a fabulous team over there. We'll put the number there, call. So Dr. Downs, Peggy, thank you so much for jumping on. And everyone,
see you. Say hi
to
you
later.